Our presentation today is on congestive heart failure. It is a presentation by Joan Pham and Nicole Romo. Today we're going to be going over some of our patient information. We'll discuss patient management options, and then we have a couple of short questions for you to answer at the end. Congestive heart failure is a syndrome characterized by myocardial dysfunction that leads to diminished cardiac output or abnormal circulatory congestion. It is primarily a condition of the elderly and is a major public health problem in the U.S. For this scenario, we have named our patient Bill Pollock, and we have a short clip about his experience with congestive heart failure.
I was 35 years old in fairly good health and came down with what I thought was the flu. And it just knocked me for a loop. It lasted about 3 weeks, wouldn't go away. I finally got to the point where I was so weak that I couldn't even walk anymore. And I kind of got the idea this isn't the flu anymore.
After hearing from our patient, let's go over his medical history. So our patient is a 35-year-old male. He has no allergies and he is living in New Jersey. Prior to this incident, he has had no other medical precautions and he has not been under the care of a physician. However, he does have a family history of hypertension and obesity. Some of the signs and symptoms that are included with congestive heart failure include dyspnea, hyperventilation, Shane-Stokes respiration, acute pulmonary edema, dependent edema, and peripheral edema, orthopnea, cyanosis, cough, chest pain, rapid or irregular heartbeats, as well as weakness and fatigue. Many of these symptoms are similar to flu-like symptoms, which our patient did experience. Congestive heart failure and the oral cavity. There are no oral manifestations that are actually directly related to congestive heart failure. However, many of the drugs and medications used to treat congestive heart failure can cause oral lesions and xerostomia. And xerostomia can increase the likeliness of dental caries as well as periodontal disease. Another example would be drug-associated lichenoid reactions.
Next is patient management. The patient may be taking medications within these categories that include ACE inhibitors, glycosides, aldosterone inhibitors, beta blockers, calcium channel blockers, and diuretics. Aldosterone inhibitors and diuretics help the kidney produce more urine and they flush the kidneys out. So the more the patient is able to pee, the more excess salt and water can be flushed out of their body. This can help in decreasing their blood pressure. There's also the beta blockers and calcium channel blockers. These help with the reduction in heart rate and they can also increase the supply of blood and oxygen to the heart. And ACE inhibitors and glycosides, they also show a decrease in mortality within the patients and have an effect of increasing the force of muscle contraction while reducing the heart rate as well. Drug interaction and adverse effects include orthostatic hypotension, xerostomia, which is dry mouth, angioedema of the lip, face, or tongue, lichenoid reactions, running mouth syndrome, and taste changes. Some clinical manifestations of toxicity can be seen, so we should be aware of hypersalivation, fatigue, nausea, and arrhythmias. During hygiene services, we should always review medical history and take vital signs. It is recommended to have short, stress-free appointments, have the patient semi-supine or upright in order to decrease lung fluid, and there is no need for antibiotic prophylaxis unless there is an underlying prosthetic heart valve or other cardiac condition. If the patient is already under good management, they can receive all of the dental treatment indicated, and they do not require a change in their normal dental hygiene care. Just be aware of the factors that are associated with the cause of congestive heart failure, and that should be considered in the care plan. Common treatment methods include lifestyle changes such as smoking cessation and exercise, discouraging alcohol intake and the use of illicit drugs, and obtain treatment for hypertension and for any lipid disorders. Management and special cautions of the patient. Make sure to consult with their physician. Administer anesthesia for stress reduction and to reduce cardiac crisis. Use stress reduction techniques if necessary. Monitor the patient closely when administering local anesthesia containing epinephrine. Make sure the patient can tolerate a supine position. Be aware of the patient's medication side effects, and raise the patient's chair up slowly, sitting up in about 2 to 3 minutes and feet flat on the floor due to potential orthostatic hypotension. Contraindications and indications. The patients with untreated or poorly managed congestive heart failure are at a high risk during dental treatment for complications such as cardiac arrest or myocardial infarction. So these events could be fatal, so it's important that the dentist must work closely with the physician to develop a dental management plan that will be effective and safe for the patient.
In conclusion, congestive heart failure is a complex clinical syndrome that can be fatal. It is a major health problem in the U.S., but by being able to identify the signs and symptoms of congestive heart failure and working closely with the patient's physician, the dental professional can prevent a medical emergency or even any potential fatalities from occurring. The number of congestive heart failure deaths is steadily increasing. That's why it is so important for us to do our part in caring for patients with congestive heart failure. And here are our 2 short answer questions. Question 1, what position should a patient with congestive heart failure be placed in during dental procedures and why? And number 2, what methods would you as a hygienist do to improve your care with a patient living with congestive heart failure?
Thank you. If you have any questions, comments, or concerns, feel free to ask Nicole or myself. And here's our works cited.